Hello. Today I'm going to be talking about the technologist role in CT protocol reviews. Okay, we're going to look at kind of the grand overview of the protocol review and management process, see how the technologist fits in that role, and then in the next talk we'll get into some more details. First, what is the goal of a protocol? Well, a protocol is really just a set of scan instructions, and those scan instructions are to communicate information to the technologist such that they can successfully perform a scan that meets the following criteria. One is it meets the imaging requirements of the exam. That is, the final product is diagnostically acceptable to the radiologist. The other one is what I call the best practice requirements. And here I'm referring to the appropriate dose, not too high, but not too low either, is used, and that is referring to the radiation dose as well as the contrast material. Generally with the scan, there should be no errors, no repeats. Everything goes pretty much as smoothly as possible, and this results in a positive patient experience. Now, before we begin writing these instructions, we have to make some assumptions. And one assumption is that the technologist is reasonably competent. That is, we're not going to start out every scan instruction with, make sure the scanner is turned on. All right, well, when we look at a CT scan protocol, you could say, well, those instructions could probably be written just by a radiologist and maybe by a radiologist and a physicist. Well, if the scan instructions were written by a radiologist, they might look something like this. Scan the abdomen and pelvis with contrast. Or some might put in some other information, such as the scan range, the slice thickness, and the recons to be used. But the general point here is that some radiologists know the scanners very, very well, others not so much. But they all know what they need for the images. They know what that final image product needs to look like. What about the physicists? Well, this is what a physicist protocol might look like. Just a long list of different scan parameters and features that are to be used. And actually, in this list, there's probably more here than the technologist really needs to know in order to be able to perform the scan. So with the physicists, we have some that know the clinical side very well, others maybe not so much, but they all should know the technical specifications for achieving that imaging goal. So between the two of them, if we combine them, we could say, well, we've got a really good start here, but it's not quite complete, and there's lots of room for variability in error. So the question is, what is missing? And what is missing is the component that the technologist contributes. For example, they know everything about patient handling and positioning, including any special considerations. And I recall once when we first got a very, very fast scanner here, we were all very excited about using this in the emergency department. When the technologists saw this scanner in action, their first reaction was, wow, we're going to have to be really careful that that doesn't snag in a catheter or knock over an IV pole. Okay, that's a very valid concern. And that's the kind of thing that a physicist or a radiologist might not necessarily think of right away. They also are more familiar with the specifics of contrast injections, and this might be in conjunction with nursing. They know very well the scheduling, the billing, the recons, the image transfer, all of those types of logistics. They have a very detailed and big picture view of all things workflow. From the minute that patient is escorted into the room to the minute they're escorted out of the room, they know everything that happens during that time. Additionally, they speak technologists. These scan instructions are for technologists. It makes all the sense in the world to have the person drafting or writing these instructions to be able to communicate technologist to technologist. Here's a few examples of what the technologist can contribute. In this particular example, there's just an illustration showing the exact positioning required for this particular exam. Here it says, practice breathing the patient on inspiration and expiration, kind of a technologist speaking to technologists on how to perform this scan. Another example, please do a timeout before starting this procedure. Check the scoop, the IV location, the contrast rate, the amount, the type. They're saying stop for a minute and look these things over before you proceed. Once you get going, things move quickly. And similarly, timing is very critical for the following sequence of events. Please read through the instructions before proceeding. Use the clock on the power injector. Okay, again, it's a technologist speaking to the technologist, giving them hints and tips on how to best perform this exam. And of course, they can use screenshots, figures, photographs, anything they need to help convey that information to the technologist. They also are familiar with the billing instructions, so they can include those kind of things as well. So everything from beginning to the end, the technologist is familiar with. They can include those instructions to make sure the entire procedure goes smoothly. And obviously, these are just a few of the examples. So when we look at our protocol core team now, we have the radiologist, who is the clinical expert. They define the imaging task. We have the physicist, who's the technical expert. They define the scan parameters. And then we have the technologist, who's the expert on all things workflow. They are the implementation expert, and as you'll see, they are the center of the protocol team. So regarding the protocol core team, we have a protocol radiologist, a protocol physicist, and a protocol technologist, which may be one or just a few technical specialists. And the reason I put the word protocol in front of these people, in front of these titles, is because these are individuals, not positions. Okay, this team will meet regularly, and during that time they will assess new protocols, they will assess any protocol change requests, they will review existing protocols, and very importantly, they will adhere to the protocol process. There is a very structured process to follow, and they will make sure that those steps are followed during this. Okay, let's take a look at the process. It starts out with a proposal. Someone has an idea, an improvement to the practice or an improvement to an exam, or the addition of a new protocol. I would suggest that you consider ideas from anyone familiar with the practice. Just because somebody isn't a radiologist doesn't mean that they don't have an idea or can't have an idea to improve a particular scan or the practice. However, you definitely need a radiologist proponent. A radiologist needs to be backing this in order for it to proceed. And the team member responsible for fielding this request is the protocol specialist, the technologist. They are the primary contact. They are the person that everyone should go to if they have any questions or concerns about the protocols. Okay, this protocol specialist will triage the request, pull in the appropriate people, and initiate the entire process. All right, after the proposal, it can proceed into the draft. And here the protocol specialist will create a works in progress document. And of course, this is under the direction of the proponent and maybe in consultation with the physicists or nursing, whoever else needs to be involved. But they will create this working document. And I would suggest that you keep this working document separate from the rest of the collection and make sure that it's clearly labeled. You don't want anybody inadvertently using this works in progress document to scan your routine clinical patients. All right, once it's drafted, then it can go into the pre-flight or pre-testing stage. And here we're going to determine if this really is an improvement on the practice. And you can do this by either starting out with phantoms with the assistance of a physicist, or you can do this on a limited number of patients. And this should be done in a controlled environment on a case-by-case basis where a radiologist or a group of radiologists reviews each case after it's done before you proceed to the next one. Obviously, the idea here is that if it's not an improvement, not a step forward, you don't want to continue doing more patients with it. And of course, you can make adjustments as necessary as you're going. If you say, this is pretty good, but I think it could be a little bit better if we just tweak this or that, then you can do that, do the next patient, have it reviewed, and proceed as such. The team member responsible for this is really the whole team, including the radiologist proponent. Anybody who can contribute to this part should be involved. However, the success or failure of this stage is decided ultimately by the radiologists. They're the ones that are going to say, yes, this is good, no, let's try again, or abort. After the pre-testing, we go into the approval stage. And here the approval must be by the protocol radiologist or a liaison. The idea here is that we don't want the proponent necessarily to be the one approving their own protocols. Otherwise, you would have everybody that's suggesting an idea and backing an idea, approving their own protocols, and that can lead down kind of a messy path. So you need to have somebody specifically designated to approve these. More than likely, it is the protocol radiologist. They might designate somebody else in cases where they feel somebody else has more expertise in a particular exam. The approval should absolutely be documented, and this documentation is done also by the protocol specialist. And they can help facilitate this approval process as well. They can follow up on things and say, yeah, we've all looked at this. Is this good to go now? Are we ready to approve this? And keep things moving that way. After the approval process is the implementation stage. The implementation stage is, again, the responsibility of the protocol specialist. They will distribute or publish the protocol to the scanner or the web, and we'll talk about some ideas for this in the next talk. They will update the protocol in the scanner. They will notify the staff of changes. Now, if these are just minor changes, things that might not even be noticed by the radiologist, they can simply send a note out to their colleague technologist and say, hey, you might notice that we've changed this protocol, just be aware of this. If it's a more significant change, something that may get the attention of the radiologist, then that communication about that change is best done by one of their colleague radiologists, most likely the proponent for this change. Our experience has been radiologists don't like surprises. If you are going to change the look or feel of the images, it's best to give them a heads up, and that is best received if it comes from their fellow colleague radiologists. And they can also include the justification for the change as well. The protocol technologist is also responsible for training other technologists if it's a more complicated exam and training is necessary. After the implementation, and actually this can be done in parallel with the implementation, is the documentation, which is a very important stage. And this is also the responsibility of the protocol specialist. They are responsible for maintaining the entire electronic protocol collection. These are the gold masters and really should be treated as gold. It's very important to keep this collection well organized. And we're going to go through some steps in the next talk on how to best do that. The protocol specialist is responsible for maintaining all of the records, including meeting minutes, any critical correspondences, things of that nature. They are also responsible for maintaining a history of the protocol changes. And this change history should include the date, a brief description of the change, a reason for the change, and the approver name. And I'll show you an example of that on the next slide. You should also keep an archive of your old or outdated protocols. If you're going to retire a protocol, just append the date at the end of the protocol name and drop it in a folder called Archived Protocols. This allows you to keep a history of everything you've done at that facility. I would suggest also, if you make major changes to a protocol, that you simply make a copy, append the date to the end of that copy, and put that in the archived version as well. That way you don't have to list every little change that you made. You can say, just look at the change history, or look at the protocol archive and see all the major significant changes that were made to this protocol. So here's an example of the change history, and I'm just going to zoom in on part of it so you can read it. This is just a small segment of one from our neuro file. And you can see that really all it is a log of activity associated with this file. And this can be very nice to have if you ever get challenged on a protocol change in the future. So if next week or next month or next year somebody comes up to you and says, who authorized you to make this change? Who said you could do this? And you can go back and look in your change history, and you can say, well, this was changed 3 months ago, and this doctor authorized it, and the reason it was needed is because of this, and you've got the answers to any questions they might have on why that was changed. It's kind of a safety net for you. Okay, next we have the review process. And at some point, the protocol is going to need to be reviewed. And this review should be done at least annually, or if anybody is questioning the protocol or has a concern about it. And what you're going to do is you're going to look for a number of things, and I'm going to go over these things in detail in the next talk. But you're going to look for inconsistencies with similar protocols. or with practice changes. You're going to look for opportunities to reduce dose, or opportunities to streamline the workflow, or to use new technologies or features. And generally, you're going to look for anything that could maybe be said more straightforwardly or more simpler. And the team member responsible for this is the whole team, at least those three critical people: the protocol specialist, the technologist, the physicist, and the radiologist. And you may also want to pull in others that you may need to consult with about a particular question or concern. And this team needs to meet regularly. And by that, I mean you're going to have to meet often enough in order to get through all of your protocols and any outstanding issues. It's a little bit difficult to say exactly how frequent these meetings are going to need to be, because it depends on your facility. How many protocols do you have? How dynamic is the content in the protocols? But you are going to need to meet regularly. Now, I know there are some logistical concerns with this, getting all of these people together in the room, especially if your physicist is a consultant and might not even live in the same city. So I've got a few hints and notes on running these meetings that should help them be more productive and more efficient. Okay, the protocol specialist should keep a running list of issues that are to be discussed. They are the contact person. Remember, anybody that has any issues or questions comes to them. They should keep a running list of these questions. They should provide that list to the protocol radiologist. The protocol radiologist then can put together an agenda and send it out ahead of time before the next scheduled meeting. Now, as you are acquiring this list, there may be some items that you can have answered outside of the meeting. If they're simple kind of yes or no type questions that don't need the full discussion by the full group, you can take care of those outside of the meeting. Certainly things like typographical errors, formatting questions, directory structures, those kind of things, the protocol specialist can handle outside of the meeting, and you don't need to spend everybody's time on those types of issues. You most certainly must have an agenda. That's very important. You need to know exactly what's going to take place during the meeting, and you need to let others know what's going to take place at the meeting as well. And you should invite others as needed, or if you think they have an interest in that, and you should send them this agenda so they know what's going to occur at this meeting. Now, at our institution, we're divided up kind of by specialty, by divisions. We've got an abdominal division, a cardiac division, MSK, etc. And each one of those divisions has a protocol radiologist associated with it. That protocol radiologist gets the agenda together and sends it out to everyone in the division, invites everyone in the division. If anyone has any feedback or opinion on that agenda item, they know that they'll need to show up for that meeting. If they can't attend the meeting, they need to contact that protocol radiologist and let them know what their questions or concerns or opinions about that particular agenda item are. That way, everything can be addressed at the meeting. Okay, if you don't have any open or pending items and you're just going to do a general protocol review, you should target the protocols that you're going to go through and make sure to send those out on the agenda. You don't want to get into the meeting room and say, oh, let's look at this one next or this one next. Have those listed out, have them queued up and ready to go. And finally, record the minutes. This is documentation of the discussions and the conclusions at this very important meeting, and it's very important that you have that written down and well documented. Generally, the goal of this meeting is to resolve all open issues during the meeting. You don't want to walk out of that room with all of these loose ends. It will be very frustrating and very challenging for you to try to get those tied up, especially if you're trying to get consensus of a number of different people. You want to get everything resolved at the meeting while everybody is at the table and focused on these issues. Now, if you have a consultant, a physicist that can't make it to the meeting, perhaps they could phone in or you could do a web conference or alert them to the specific items that they can contribute to so you can get those resolved during the meeting. But that's very important to wrap things up as best as you possibly can during the actual face-to-face meetings. So here's the entire process. And if we highlighted the steps here, which are the primary responsibility of the technologist, you can see that it's by far the majority of steps. Okay, if we highlight the steps that the technologist has some responsibility in, you can see that it's all of the steps. But there's one more thing that's not immediately evident in this illustration, and that is that the technologist is also responsible for these parts, the arrows. The technologist or protocol specialist is really the engine that keeps this whole process moving. They carry things from one step to the next and complete the entire cycle. So the protocol specialist, the technologist, really is the center of this entire protocol process. A few important things. First of all, you can't go at it alone. All the team members absolutely must be committed to this. Those three critical players are essential, and everybody must be equally committed. You can't walk into work one day and say, I'm going to take over the protocols, we're going to do it right this time. You need to have those people committed to make this a success. You also need support from the department, very essential. They will need to dedicate some time for you. There is too much work here, and it's too important to try to squeeze it in between your normal day-to-day responsibilities. They must allot you some time. You will also need some resources. This might just be access to a computer, it might be some server space, it might be some web support, but you are going to need some resources in order to do this. And finally, you need to be empowered. Okay, you will be contributing to the protocol discussions. These are very important discussions. You will be making decisions. Those decisions need to be respected. You will help to define and enforce this process. And the enforcing part is probably the most challenging part of it. For example, if a radiologist comes up to you, the protocol specialist, and says, I want this change made in this protocol right now, and I want this to be how it is forever. As the technologist, you have to be able to say, I'm sorry, I can't do that. We have this whole process. I'm not authorized to make that change. And you could direct them to the protocol radiologist, you could explain the process to them, but you simply just cannot accommodate them like that. You can't allow for these loopholes or shortcuts in this process. The whole thing will come crumbling down in very short order. So in conclusion, the protocol specialist, the technologist, has this very unique and valuable insight and experience that they bring to the table regarding protocols. They are the center of the protocol process. They are the engine that keeps it all moving. They are the caretaker of the entire protocol collection. This is a very important collection of documents. And because of that, they are an integral member of the protocol team. They are equally as important as the radiologists and the physicists in this discussion. And this protocol management and review stuff is really a big deal. Okay, it's not only a big deal because it's going to be required for ACR accreditation in December of this year, but when you think about it, everything you do in a CT department begins with a protocol. Every scan you do begins with a protocol. So the protocols really are the core of the entire CT practice. And by optimizing them and having them managed well and reviewing them, you are ultimately optimizing your CT scans and your patient care. So it's very important. Thank you.